Welcome to another episode of Judgment Date. As you know, we've been doing these programs now for many, many months, dealing with all of the implications of COVID-19, trying to help people through it, really. We've been looking at the medical side, the economic side. We've even looked at some of the ways in which we'd be able to reconstruct society, the legal side of COVID-19 and its consequences. But I'm afraid, as much as I was hoping that I'd be able to finish with these programs, that's not the case, because we are now in a very serious second wave. And I'm delighted to welcome to the program Stavros Nicolaou, who in his capacity here is the chair of Business South Africa Health Working Group. Thank you so much for giving us of your time. Stavros, I want to know, what role is your working group playing with regard perhaps to COVID in general and the vaccine acquisition in particular?
Judge, firstly, thanks very much for having me on your program.
Pleasure. Yeah.
And, it's indeed a great pleasure to provide some of our insights as Business for South Africa, and specifically the Health Working Group. Business for South Africa was incepted in the midst of a crisis. Its early manifestations were as a consequence of a BUSA board meeting that took place last February. And I think business was starting to get to grips with understanding what was happening globally at the time. And we realized that it could not only be left to governments around the world, and specifically in our case, our government, to deal with what is arguably the biggest crisis we faced globally in the last 100 years. So we, at a very rapid pace, were able to assemble organized business, both from BUSA and the Black Business Council, put together various working groups. There was one that dealt with the economy, one that dealt with labor-related matters like TERS and UIF. And then, of course, there was a third one which would support, assist, and complement government with its public health response. And that is the one that I've been leading for the last 9 or 10 months. I must say that dealing with COVID across public and private sector is an incredibly complex process. It's unprecedented globally, and let alone in our country. And what has been absolutely heartwarming for me has been how readily business, the private sector, has stepped up in a very unselfish way and made available resources across many, many different platforms and many different areas within the healthcare system. So, for example, we were able to, on a relatively seamless basis, acquire, in partnership with the Solidarity Fund, 90 million pieces of PPE. This was done in a transparent, non-corrupt fashion, and it helped frontline healthcare workers. And we had a significant emphasis over all 9 months on the frontline healthcare workers, because they're the truly unsung heroes here. And the last thing that you ever need in a country is your healthcare workers down in tools, particularly your doctors and nurses. They're largely at the front line. That would have been catastrophic. And many of the activities we pursued, either individually or jointly with government, largely aimed at 2 things. Number one is ensuring that our healthcare workers in the front line are kept as safe as they can be. And secondly, where could we complement and support existing programs to optimize the outcomes? The outcomes we always seek here are, how do you reduce mortality and morbidity? Regrettably, we are seeing now, through the South African specific variant, we are seeing a raging second wave, which is seemingly more contagious than the first wave that we experienced. And the jury's out there as to whether it's more virulent or not. But we are seeing higher mortality rates this time around, and also younger people that are being affected. So as we move into the second wave, and we're not anywhere near the peak of the second wave as yet, we are reassembling some of the resources that we put together as Business for South Africa early on at the start of the pandemic last March.
Let me ask you this. If I can, I mean, there were letters written, I noticed a letter written by a whole group of healthcare workers to that very commendable magazine or publication, Ground Up, in which they complained bitterly that they did not know when they were going to get the vaccine. And frankly, to be honest with you, if you listened carefully to the webinar on Sunday, if I was a frontline health worker, I still wouldn't know. And that's really very disturbing. I mean, what message are we sending to them?
So I think, firstly, it's important to say that the single most effective tool that we have at our disposal right now to start managing the pandemic is a COVID vaccine or vaccines. There isn't just one vaccine. There are multiple vaccines, and they have different levels of appropriateness and or suitability for South African conditions and circumstances. So naturally, there will be despondency, not unsurprisingly, from the healthcare workers, because this is a game changer. We know that we need to vaccinate around 67% of the total population.
Roughly 40 million people.
That's quite right. And this would have to be done in order to achieve what we call herd immunity. Herd immunity is the epidemiological endpoint of a pandemic. That is critical, because achieving that endpoint will allow us to return to normality. And in a context of business, it will set us back on some form of economic recovery. You cannot recover economically.
Would you agree with me that absent a reliable vaccine and absent the kind of plan that you're talking about, this economy is going to stop and start and will be in a disastrous situation until we get to that position?
Judge, I absolutely agree with your assessment, and it's something that is deeply concerning to business. And that's why, as business, we believe we need to redouble our efforts as a country, because this is not just a government issue. It's not just for government to solve neither the COVID crisis nor the vaccine issue.
So let me ask you that about, I agree with you. So the question is, I suppose what I'm asking is, our business now, I'm not going to ask you for details, that would be unfair, but what I think the public is entitled, would be interested in, is to what extent of business now in the game? You know, in other words, let me be blunt. If you look at the reaction to the webinar on Sunday, it was hardly favorable. All sorts of groups across the range were horrified to the extent that they, whether it's correct or not, their perception was government's been sleeping on the job. So the question I suppose I have for you is, let's leave that aside for the moment. Our business now in the game, you guys know a lot about this. You yourself, I think, I don't know if you're the chief executive, but you're certainly very central to Aspen. So you know about these things better than almost anybody else in the country. So are you in the game now? I mean, is business now going to be saying to government, come on, we can actually do this together and we can get sufficient vaccines to get that herd immunity? I almost used the word, herd mentality, which is what Donald Trump apparently called it. But are you guys now, I mean, is there some real participation here?
So as of 2.5 weeks ago, business has entered in a very serious way the conversation. I'll expand on that in a moment. But I do want to re-emphasize the point again, that we cannot leave this solely to government. This is a societal issue, and it includes business and all other social partners for that matter. So as of 2.5 weeks ago, business has become actively involved. We have a particular focus in 2 areas. The first area is, how do we assist with the financing and funding piece of this? So we need to recognize that where we sit at the moment, although there are significant efforts being made, we still don't have any certainty as to whether we will land any vaccines in the country in Q1. Now, we know that at very least in Q1, we should be vaccinating our healthcare workers, which are about 1 million. We require about 1 million lives.
Yes, about 1 million, 1.2 million, yes.
Correct. So at very least, we should be looking at, and there's a whole risk algorithm that's been developed by the Ministerial Advisory Committee that sets out the different risk groups and the hierarchy of how you would vaccine administration. So the first categories are the healthcare workers and your population that is 70 years and older. That's the first grouping you're looking at. So at very least, we should be moving heaven and earth to achieve that result, that we vaccinate that group within Q1. Okay, so what is business doing? 2 areas, as I said. Firstly, we're trying to find, and I think have made significant progress in the funding and financing piece. Because when you're not at the front of the queue, as is presently the case with these vaccine manufacturers, it's an absolute requirement that you're able to demonstrate to them that you can fund and finance these vaccines. Otherwise,
but why, for example, can't we raise the money through some surcharge? I mean,
yeah.
Well, I did a back of a cigarette box calculation. So if you simply took everybody on the tax tables from R1 million upwards, which are basically just over 300,000, but it's probably a lot more, and you charged and you did an escalating thing up to 5,000 or 6,000 rands additional income, you could raise 5 to 10 billion rand perfectly easily.
So I think you're quite right, and I think that has come into the discussion. What we've done, however, as business, we've said, look, you've got 6 million COVAX lives that are going to be covered at some point in time.
That's COVAX? Oh, yeah. Okay.
That's COVAX, correct. So that leaves a deficit or delta of 34 million lives that you still vaccinate. Okay. The private health insured segment of the population, what we call medical aids,
about 25%, I'd have thought.
Are actually 8.9 million lives. So these are lives that are covered under private health.
That's about 15%. Okay, yeah.
70% of that. You're roughly looking at 7.1, 7.2 million people that you can vaccinate through that segment. Okay, so business under the lead of Adrian Gore from Discovery have been working hard at this to work out an arrangement where the medical schemes fund 1-for-1. And in fact, the legislation, the Medical Schemes Act, doesn't make provision for this. So there's a circular that's just been released today from the council that now qualifies a COVID vaccine as a prescribed minimum benefit.
So that would get you up to 15 million. That would get you up to 15 million.
Correct. That would be roughly 15 million, and then you've got your 6 million COVAX. That takes
you 21 million. That's a third of the population already.
So that's you add half at 50% that way, right?
Okay.
So now, what to do about the remaining 50%? Okay. There are other initiatives happening within business, and this is looking at largely big business at this point in time. It will expand into other segments and sectors of business in time. But there are significant employers in this country, mining houses, for example.
Yeah, who could do their own employees, yeah.
Correct. They have significant healthcare resourcing. So we are also in quite intense discussions with the top listed companies in South Africa as business for South Africa, looking to see how we can raise the balance and also looking to use internal resources that reside within these companies, not only to vaccinate employees of those companies that are uncovered. And incidentally, when I spoke about the schemes, the other 7 million would be uncovered lives. So there's 7 million covered lives. And
I appreciate that.
So you would look to do a similar thing through business, where you would internally vaccinate family members of your employers, for example.
Yeah.
That could be expanded to the communities that those businesses or mines or banks or whatever the case might be operating. So that's a very serious conversation that is going on at the moment.
But presumably,
I don't have the details of it because it's
not
appreciate that concretized yet. But I'm just demonstrating the last 2.5 weeks what business for South Africa in particular.
No, I appreciate that's enormously important. But can I just ask you this, just to start with on this point? Why is it that other middle-income countries like Colombia, etc., seem to have been able to acquire a significant amount of vaccine already? Why are we not? Why are we, you and I, having this debate at where it'll come in the end of the first quarter, the beginning of the second quarter? Why have we got nothing in the pipeline at this particular point in time?
So Judge, look, I don't want to speak on behalf of government because I'm here very much.
No. I'm not asking you. I'm just talking as somebody who knows a lot more about the topic. I'm asking you as somebody who knows a lot more about the topic than I do. And I have no doubt that people listening to this would want me to ask you that question. If you can't answer it, that's...
Sure. So I'm going to give you a business perspective, as I said.
That's fine. I'm happy with that.
We, South Africa, as all other countries around the world, had two options in securing these vaccines. You could either go the COVAX route, or you could engage in bilateral discussions.
Could you not do both?
Or you could do both, okay? And many countries have done both. And the way I understand it is our government did pursue both. They pursued COVAX initially, did pursue bilaterals, but haven't concluded these bilaterals. I'm hearing that they're hoping to conclude some of these bilaterals during the course of this month. Okay, and if I've got to be a little more granular, the way I see it, there are 6 candidate vaccines. Okay, for 2 of those, the Russian and the Chinese one, we don't have the data yet in South Africa. That leaves you with the other 4. And there are probably 3. The 4th one being Moderna, which is an American.
Yeah, they're not interested. So
they can't supply until Korea.
So let me put this to you, Stavros. I mean, as I understand it, yes, that's right. Well, frankly, you're welcome to take the Russian vaccine. You know, not in a million years would I do so unless you gave me a serious, respected scientist view that that vaccine is not a Putin concoction, but is a serious vaccine. The Chinese may be, but we haven't got the data according to Dr. Pillay. Moderna don't necessarily want, I don't understand why, but that's disgraceful, but that's not your fault, nobody else's. Then there's 3. My understanding is, correct me if I'm wrong, whilst Pfizer we could use, Professor Sharp said to me, he conceded when I interviewed him, that because of the refrigeration requirements for Pfizer, whilst we might be able to use it for the healthcare workers, it's not really viable for the widespread 40 million because we don't. So really that leaves Johnson & Johnson and AstraZeneca.
So look, I think, Judge, we don't have a problem in securing vaccine. We've got a serious timing issue here. That's the issue. Because
I mean, when you say we don't have a problem, what do you mean we don't have a problem? Nobody's telling us at this point that we've got any vaccine at all.
We've got a timing issue. It's very much a timing issue because get a vaccine in Q3, you can, but it's too late, right? So we need to focus on Q1. Okay.
So could I ask you, but even Q2, I mean, realistically speaking, I mean, there are only 2 vaccine sources that are available to us.
I think we need to pursue the 3 vaccines, Pfizer,
which is the third, but
and AstraZeneca.
Bluntly, is Pfizer a viable vaccine when you need the kind of refrigeration requirements in rural areas, in other parts of the country, other than your major urban areas at best?
Okay, Pfizer is a stopgap when you can't access.
That's what I meant.
And you use Pfizer largely in metropolitan areas.
That's what I meant. Yes. Okay, I accept that.
So what I'm saying is, if you sequence all of this, you got to kind of take what you can get in an emergency right now.
I agree.
And where I think we are as a country right now is government are hopefully rigorously, as they are saying, are pursuing the Pfizer and the AstraZeneca option in Q1, and then looking at AstraZeneca and J&J in Q2. That's where we are. If we deliver that as a country, Judge, then I think we are going to start getting ourselves out of the woods.
I agree with you, but the question I suppose I have for you is, it is for the ordinary member of the public, it's astounding to read from the advisories that the government started negotiating in September, maybe even earlier than that. And in fact, as we sit, in January 6th, we still do not know whether we'll get any and how much we're going to get from AstraZeneca. And of course, I don't need to remind you that in relation to Johnson & Johnson, we haven't yet got through the 3rd stage trial, so we don't know about them at all.
Correct. So the singular focus in Q1 is AstraZeneca in the main. And then,
do you think it's possible that AstraZeneca, outside of the 6 million, 6 million doses that we could get from COVAX and possibly some more for our healthcare workers from Pfizer, do you think it's viable that we'll get sufficient AstraZeneca to vindicate the government's promise that by the end of this year, we will have actually vaccinated 67% of the population?
Okay. If we're looking at 4 to 5 million doses in Q1, because that's how the algorithm are playing things.
Yes, okay, that would come from COVAX, would that be right?
No, it wouldn't. So the COVAX supply was scheduled for Q2, as President announced. Okay. Understanding is my understanding from government is there's been some progress in rescheduling a part of that to come into the latter parts of Q1.
So where does the first source of supply come from? The 5 or 6 million that you're talking about?
Okay. Then my understanding is that Pfizer and Astra have both offered limited supply, because they're not talking tens of millions of doses, limited supply in Q1. So if government concludes these Q1 agreements with Pfizer and, as I said, on a limited scale, and on a bigger scale, AstraZeneca, if they conclude that, then I think you can start covering a significant portion of that category 1 risk patient pool.
But that leaves, that's 1.2 million. That's fair enough. And it would far be it from me to do anything other than say, please God, that we should be able to cover every single heroic healthcare worker. But the truth is, that doesn't cover swathes of vulnerable people, many of whom may die unless we get a vaccine.
Yeah. So I think, to be clear there, Judge, my understanding from the, and we've only entered into the fray quite late at business.
I appreciate that.
And we're putting significant positive pressure, because it's also, and I'm not sure the negative pressure gets you anywhere. So where we can help and speak to people and look into Rolodexes and find people around the world, business has been doing that in the last week. So I'm really hoping, because there are doses available from Pfizer and Astra in Q1, that as a country we can conclude those arrangements, because then we can vaccinate 1 million healthcare workers, but also some of those high-risk patients, the 70-year-old patients.
Could I ask you this, though? I suppose this takes you out. I'm anxious. I don't want to talk to you about your role in Aspen, but I do want to ask you this on a broader sense. I mean, what is the capacity? There's a lot of confusion about what capacity, if any, we have in South Africa to produce a vaccine. And my understanding is that, the president announced not that long ago that there was some agreement with Johnson & Johnson to produce 300 million doses. But then I understand it's not producing the doses, but it's sort of like the end part of the production line. Is that correct?
Okay, so it's partly correct. So let me clarify it in exact terms.
I think people really want to know about this, and you're the right person to ask. Yeah.
Okay, so to manufacture a vaccine, you need to get what's called the active substance. So that in the case of Johnson & Johnson, it's an inactivated virus, if I can put it that way. It's a viral vector, as we call it. So that active substance is made abroad. It gets exported to South Africa under very specialized conditions. The Aspen plant in Port Elizabeth will receive that active substance and will then do what we call the vial filling. It fills the active substance with the other solution that goes into a vial. It's 5 doses per vial. It seals Aspen will seal the vial, package it, and then it's available for consumption globally. In pharmaceutical jargon, that is called formulating, and that's largely what we do with all pharmaceutical products in South Africa.
The production of the vaccine doesn't originate in South Africa as such.
The active substance doesn't, but the final.
And where is that? Is that produced in India, which is the main, or elsewhere?
So this particular active substance is produced in Europe. In this instance, there are others that are produced elsewhere in the world. And as I said,
could I ask you this?
Right.
In the other piece of confusion was that the New York Times reported about just over a week ago that Johnson & Johnson were going to produce what they called, I think, 100 million doses, and that this would only be for export. And that's what you might have seen that article, I suspect you have.
yes.
Is that not accurate then? Is it possible that some of those doses could be available for South African use?
Okay, so Aspen is going to be contract manufacturing for Johnson & Johnson. Okay, so it doesn't own the stock, it's Johnson.
No, I appreciate I can't blame you. No,
it's an important point to make because Johnson & Johnson have also said they targeting to manufacture 1 billion doses this year. And remember, the data we've got currently is that Johnson & Johnson is a single rather than a dual dose regimen.
Which is a massive advantage.
It's also important. But of course, we've got to wait for the phase 3 data, as you said earlier, Judge. So they're aiming to make 1 billion doses. Aspen has committed to making roughly 30% of that targeted production for them. Johnson & Johnson have also gone public, saying that 50% of what they produce in 2021 will be made available to emerging and developing markets, which South Africa is included in that. So, assumedly, you could have a situation where the product they make elsewhere comes into South Africa. And I understand they have offered South African government some supply. I don't quite know all the details of that. Or it might even be that some of the Aspen product that's made here gets used for South Africa. We don't quite know that because all the production in South Africa will fall into J&J's global supply chain. They will then decide exactly where it goes to. Some will go to South Africa.
Can I just ask you this? Presumably they're using your facility because they think you guys do an efficient job. They wouldn't be using plonkers for this particular. They would be using people who do the job.
Correct. And as it stands right now, Aspen is the only company on the African continent right now, as we speak,
right,
that is able to make the COVID vaccine.
Now, this may be difficult for Aspen because it would be unfair for me or anybody else to burden Aspen with the burden of saying to Johnson & Johnson, we'll only manufacture this for you if you can do so much for South Africa. But I'm particularly intrigued by the fact that surely a government which announces this not that long ago can actually go off to Johnson & Johnson and say, look, if in fact you're using our facilities, and we're delighted that you are, you know, at least some percentage, a small percentage maybe, should be used for domestic consumption. I mean, the very workers who be filling those, doing that, I mean, they would be entitled, it seems to me, to be vaccinated. I mean, just to take a simple logical and moral position.
No, you're quite right, Judge. And I think those discussions are happening between South African government and Johnson & Johnson. I think it's even been reported in the media. So
Stavros, let me ask you then. I mean, sorry, just out of interest, I don't know whether it's in your field of expertise, such, but since you're at Aspen, is there a concern now that the actual vaccines that are operating now are not going to be suitable because of the variant?
So
please.
Let me just explain what happens with a variant. And it's not an unusual event that viruses mutate. They mutate all the time. We know this. A good case in point is seasonal flu. And that's why you have a different strain of flu every year. So it's not an unusual event. And I think we shouldn't be overly alarmed about that aspect. The fact that it's more contagious than the first strain, that's alarming, sure. But it shouldn't be of any surprise that these things mutate. In the mutation, there is some reconfiguration of the protein of the virus that takes place. I'm just trying to put it in the simplest terms that I can. But the vaccines that we've got presently work on that protein of the virus. And there are studies that are going on at the moment to try and understand the exact nature of the configuration of the protein and whether the vaccines would still be appropriate for this strain or variant that we've got. So that's ongoing work that is happening by our own Ministerial Advisory Committee, I understand. So that is ongoing work. There is a feeling, and this is very anecdotal, I don't want anyone to hold me to this because I've been speaking to clinicians about this, right? Because it is something that you've got to take quite seriously. So please, very anecdotally, okay, the feeling, call it gut feel, knee jerk, whatever you want, from clinicians is that these vaccines that we've got presently ought to work with this variant.
Okay. All right. That's great. I mean, I hope it, you know, from your mouth to God's ears, as they say. Could I ask you, as we're running out of time, what about the distribution? I listened very carefully to the webinar, and it appeared to me that what was being suggested, that, well, there'll be vaccines at clinics and all over the country, but you've got to get the vaccine there. You've got to actually get the damn thing, and 40 million is an exercise of a kind we've never done before. I know South Africa's had a lot of experience and commendable experience in the post-Mbeki era with regard to the HIV drugs, antiretroviral drugs. But I mean, are you guys going to be joining in with government to actually have a concrete plan as to how to get the vaccine from, let's say, point of supply to all over the country? And I mean, everybody tells me that the private sector, I know from my own work on the Competition Appeal Court, that someone like SAB are unbelievably good at distribution, as are many others. Will they be brought in to the process that they can assist to get the vaccines to the various far-flung parts of the country when we finally get sufficient supply?
So business has commenced a discussion with government on what role, if any, it can play with respect to logistics, supply chain. And I think, as you correctly pointed out, some of the vaccines are more suitable than others. So the ones that you store at ambient temperatures, 2 to 8 degrees Celsius, are a lot easier to transport around our country. And look, our country is very geographically diverse. You know, I know a lot of people are looking at Israel at the moment. You know, you can fit Israel 1.5 times into the Kruger Park.
No, I accept that. It's a 7-8 million population. It's unfair. I know. Yeah.
Correct. But what we have established is that with the ambient temperature options that we've got, we have a very well-developed network of logistics and supply chain providers across the country that are able to, you know, we move millions and millions of units of drugs every day in this country. If you just take the private sector, most, if not all pharmacies in this country, I'm talking private pharmacies, get deliveries twice a day. And, you know, many pharmacies provide for vaccines these days. So I think there's a degree of confidence that the logistics and supply network that's required exists in the country. The challenge is coordinating that and getting a cohesive, uniform private and public sector. So that's the issue that we need to grapple with, because how do we leverage private and public resources with one common goal here? And I think that's the conversation we're having right now as business with government.
Well, because if countries, many other countries, are struggling to get their vaccines out to people who are more sophisticated, more developed countries than ours, I mean, obviously it is a concern, because this is an order of a different magnitude. 40 million people, maybe 80 million vaccines if you're going to use the double dose. I mean, I don't know. But I'm running out of time. I want to ask you just one final question, if I may. And it's this. I mean, if you look at the plan, which is a plan to get people vaccinated by the end of the year, I'm not asking you, I'm going to write this down and sue you if you don't, but just from your vantage point, is this a realistic plan that we could get close to 67% of the population vaccinated by 31st of December of this year?
I think with the right cohesion, coordination, will, and getting every single resource that we have available at our disposal assembled at once. I think it is something that that we can get very close to, I believe. But I think what's more important, we need to get to that, because if you start missing these timelines, you don't get herd immunity, right? Because it's not like you're going to take this vaccine as a once-off and you're immune for life. That's not the case. Okay. So there are many different considerations. The difficulty we've got right now is we don't understand enough about the pandemic. So you're building the car whilst you're driving it. So the best way to answer is we need to do two things. One, we daren't miss some of these deadlines because it sets you back all the time. And secondly, we need to assemble every possible resource we can in the country. This is a national emergency, a national issue, and you need to get the whole nation involved.
I couldn't agree more, and that's why I wanted you to be on this program, because it does seem to me that your expertise and that of your committee are absolutely vital to this, for which thank you very much. I have run out of time because I had about another 25 questions to ask you, but you've answered many of them and helped enormously to bring some light to this very difficult situation. Which thank you so much for giving up of your time.
Thank you, Judge, and thanks for having me. It's appreciated.
Pleasure.